As we move into the next stage of the COVID-19 pandemic, we are restoring and recovering our services, and safety for you and our team remains our absolute priority. With this in mind, we have made significant changes at our sites in line with government regulations. If you haven't already, we recommend you watch our Keeping You Safe When Visiting ASPH animation, which talks about these important implementations. This animation talks about what you need to do if you are coming into hospital for planned surgery. All patients coming for planned surgery must be swabbed for COVID-19 72 hours or 3 days prior to admission. You will be given a date and time to attend Ashford Hospital for your test. It will be carried out in the red tent area located between the main entrance and outpatient department entrances. Please come by car. Pull into the lay-by in front of the red tent. Remain in your car and a nurse will come out to meet you. The nurse will be wearing personal protective equipment, including a mask, apron and gloves throughout the procedure. A swab is taken from the back of your throat and nose. This will only take a few minutes. If the result is negative, your surgery will go ahead as planned. If it is positive, your surgery will be rearranged for the next possible date. To minimize the risk of exposure to COVID-19 for all patients and staff, you will need to take certain precautions prior to your surgery. 2 weeks before your surgery, you should take extra precautions and, if possible, do not go to work, shops or public places. Use public transport or taxis. 3 days before your surgery, once you have been swabbed for COVID-19, you must self-isolate. This means you should stay at home with members of the same household only. You should not go to work, shops or public places. Use public transport or taxis. Do not have visitors in your home, except for people providing essential care. We are doing everything possible to minimize the footfall across the hospital sites. So please ask your friend or relative to drop you off outside the main entrance and not to come inside. If you need assistance, we will provide this. You will be greeted by a member of Team ASPH at one of our checkpoints. You will be asked a series of COVID-related screening questions. Have your temperature checked, asked to use the hand sanitizer and be issued with a surgical mask. You will be directed to the appropriate area and staff will explain what to do. Social distancing measures are being implemented in all department waiting areas, so please respect these and keep a minimum of 2 meters away from other people. The team caring for you will explain everything throughout your time on the ward. We are following very strict infection prevention and control guidelines, and all staff caring for you will be wearing appropriate personal protective equipment. We have thorough cleaning regimes in place throughout the day. Please rest assured that we are doing everything possible to keep you safe whilst in our care. When you are ready to be discharged home, the nursing team will contact your relative or friend, and the discharge process will be conducted via speakerphone in a private consultation room. We will ensure that you have understood all necessary information before advising your relative or friend to come and collect you from outside the hospital entrance. We will make sure you are safely collected by your relative or friend. If you are worried or have any questions, then please contact the pre-assessment team before your surgery or ask any member of the team caring for you on the day. We are here to help and reassure you. Thank you for your support and patience in following the guidance and helping to keep everyone safe.